Good evening, everyone, and I'm Professor Rashmi Sarkar, the chair of the ILDS Education Committee. And as you know, the ILDS Education Committee runs these master classes webinars on different topics by global dermatology experts. You've been hearing them. We also have another series, which is the Global Dermatology Leadership, My Journey, which features some of us, our most renowned global dermatology leaders. And today we have with us, on this occasion of World Health Day, which is celebrated every year on the 7th of April. And the theme this time is Together for Health, Stand with Science, I think, which is very pertinent because it does talk about innovation in science, strengthening evidence-based policy, and promoting global collaboration to protect the health of people and the planet. And this is, of course, always done by the WHO, and hence also this is a very important part of ILDS also. And I think this is a perfect day, that is why, to celebrate one of our global dermatology leaders. And I'm very happy to say that we have with us today none other than Professor Roy Chan. Professor Roy Chan is the one who's going to take us today through the Global Dermatology Leadership, My Journey. And believe me, these are really interesting. These are really inspiring. And I'm sure that all of you do know him, but there are just a few words, I'd like to share from his very, large biodata. So Professor Roy Chan did his medical training at the University of Singapore and his postgraduate training in internal medicine, which was in London, in dermatology at St. John's Institute of Dermatology, STI at St. Stephen's Hospital, and public health in HIV at UCLA. His dermatological career started at the Middle Road Hospital in Singapore in the 1980s and continued at its successor, the very well-known National Skin Center, NSC. He was appointed director of the NSC from 2004 to 2014, and he is currently emeritus consultant. In fact, he is responsible for bringing in a lot of changes at the NSC, and he has contributed so much to its growth. He is also clinical professor at Weill School of Medicine, National University of Singapore, adjunct professor at SSH School of Public Health, National University of Singapore, adjunct professor at LKC School of Medicine, Nanyang Technological University. But most importantly, you know him well. He's the face. He's the president of the 25th World Congress of Dermatology in 2023 at Singapore, which many of you attended either as delegates, as faculty, and also as scholarship holders. He's also the president for Action for AIDS in Singapore. Well, among other significant appointments, he's also the inaugural chairman of the chapter of dermatologists of the College of Physicians, inaugural executive director clinical of the Skin Research Institute of Singapore, SRIS. His clinical and research interests include STI, HIV, cutaneous infections, and diseases of the hair. In fact, his involvement with HIV programs, advocacy, and activism is really over many years, and it's over 40 years. We are definitely very interested in hearing what you have to say about your global leadership journey and where you've reached today, which I'm sure that most of the young dermatologists and even the middle-level dermatologists are going to find very inspiring. What I'd like to say is this meeting, this webinar is different. So this is for the participants. When Professor Roy Chan finishes, you can actually ask him questions live. You can maybe raise up your hands or write in the chat box and ask him a question directly by unmuting yourself, and Professor Roy Chan will take up the question. I will just start up with maybe one or two warm-up questions. So please feel free to ask these questions to Professor Roy Chan. And over to you now, Roy. We are eager to hear from you.
Thank you very much, Rashmi. And thanks for inviting me. It's such an honor to give this little fireside chat, I would say, is rather than a lecture. So when I was asked to do this, I said, yeah, of course I have to. I've actually been giving similar talks to several other organizations here in Singapore. And I thought I'd I'd include my great involvement in venereology as well as dermatology. So let me start. I have a lot of slides to go through, so I might move quite quickly. So these are some of the more important projects I've been involved in. They include personal experiences, perspectives, anecdotes, and insights, significant events in my life, in my career, turning points, important personalities that have I've come across my life. It's systematic, but certainly not an exhaustive recap. Uh, so I'll start here, and this is me when I was very young, and I think Rashmi might have mentioned I swam in the Munich Olympics in '72. That's me in Munich in an Olympic t-shirt, and then the main photograph is me and my father. My father was a general practitioner with an interest in. He was a specialist in dermatovenereology as well, and in those days, the training was there was not such a clear-cut specialization. You know, you sort of work your way in and you adopt sort of that sort of fame. And this is Loch Ness, and I was traveling around UK with him. I was at this point in St. John's, okay, with colleagues, many of you who would know, like Malcolm and Neil Smith and Wilson Jones and that lot. And I can't remember, this was 1984, so I was like 28, 29. I had finished my medical school, and I was doing my dermatology in St. John's. So the plan was that my father wanted me to take over his thriving private practice after I finished, but things didn't things didn't worked out completely differently. And the context was that turned out completely differently, as we all know. In the early 80s and mid 80s, there was an explosion of for HIV/AIDS in America and in Africa and around the world. And the history is well known to many of us. Some of us might not have known because we now have lived through the very bad parts of the AIDS epidemic. And as a young dermatovenereologist, what do? You have to take up the cudgels. So this is what happened. And when I came back to Singapore in 84, 86, I started to work straight away at the Middle Road Hospital. I think Rashmi has mentioned that. And so I'll discuss my career, these three tracks. Really, I had three parallel but really interconnected career tracks. The STI track, the HIV track, and then the dermatology track. And these things were happening concurrently. There was not like one after the other. I was doing three things at the same time. And I started the STD track. So when I first started, when I came back, soon after I came back, I was asked to take over the STI program. And it became quite clear to me that we had to, in order to control HIV, we had to make sure our STI control was really good. And launched into a lot of programs in conjunction with the School of Public Health, looking at mainly our target groups were mainly key populations with sex workers, young people, and MSM. But in terms of STI control, we started definitely with the brothel-based sex workers, which we had. So I started a program where we aimed for 100% condom use and zero infection rate, brothel-based, amongst brothel-based prostitutes. We have had this medical surveillance scheme in '76, and we doubled up on information, knowledge, skills exchange, skills education about protection and prevention and condom use. Taught them how to recognize signs and symptoms and how to encourage negotiation skills to get 100% condom use. And within a very short time, so these are pictures of some of the efforts which we made in brothels. We made posters. We went out and made sure that they were displayed, make sure that condoms were displayed. And this showed very quickly that the arrow is where we started the program, and we managed to drop the infection rate amongst sex workers of gonorrhea and sex workers to a very low rate very quickly, purely because of condoms and also because of timely treatment, testing and treatment. And this is the same thing for infectious syphilis, and this was total population, not just sex workers, but the total population of infectious disease fell very, very, very drastically. And this is another way of looking at it. Our program for vaginal sex, condom use amongst sex workers for vaginal sex, it went up to almost 100%, and they managed to continue that for decades. And very low gonorrhea, cervical gonorrhea rates have continued to be very, very low and close to zero in our cohort of sex workers. Very early on also, we realized that oral sex was very important in the transmission of pharyngeal gonorrhea, and we were one of the first people who introduced condom use for oral sex amongst sex workers, and it showed again that when we brought up the rate of condoms for oral sex, the rate of pharyngeal gonorrhea also fell significantly and has been maintained as such. We also focused on young people. We introduced programs for polytechnics, junior colleges, and pre-university centers. All students were involved in this, and after a few years, we handed it over to the Ministry of Health to take over. So we call this Project Youth Inform. We focus on secondary sex workers, and these in our situation were massage parlors, masseuses in massage parlors, and we carried this on for quite a long time. And again, promoting the use of condoms, knowledge of STI/AIDS, and so on and so forth. We targeted bars and nightclubs like everywhere else. There's a lot of secondary or indirect sex workers working as hostesses in clubs, so we targeted them. And then also we targeted streetwalkers. You have in any country the regulated or the brothel-based sex workers, but then you also have streetwalkers, and it was a difficult thing because it involved a fair amount of danger because you go out and handed out condoms and so on. We actually had to interact with sex workers on the street. And it was dangerous because, in terms of PIMS, in terms of police raids and so on, but that was what we had to do. So that's the STI part, and I continued to be head of the STI control program until earlier this decade in 2023. As far as the HIV/AIDS programs, which I was been very, very much involved in, I think Rashmi has mentioned, I founded an NGO because when I came back in '86 from London, I realized that the authorities had very little idea of what to do in terms of prevention. So I took it upon myself. I gathered some friends, and we got together an interim group. This was in 1989, our first executive committee. I was secretary. I got friends, and some of them are doctors, some lawyers, and so on. Very young people, some more established people, and started programs. This is the first ever public education program we had, handing out condoms in the street. Never heard of, I think, in Singapore. We involved a lot of performers and stars get involved. In AIDS in those days, I think it's different from now. It was a really hot topic, and it was because there was no treatment, almost certain death. I think it was people are very frightened. The stigma was enormous. So we managed to mobilize a lot of support from the community. In 1990, with our first ever World AIDS Day event, and then worked a lot with private companies, and particularly good relationships with PR companies, advertising agencies, to produce mass media campaigns. We had our own publications, and this is all done in-house. And I used to run the organization from my consultation room. And people would come in and sit, and I'll be seeing patients, and the patients would see all my material all over the wall, and they would be suitably impressed or frightened. I don't know what it was, but I was doing a lot of jobs at the same time. In 1991, we started our first anonymous clinic. That's me then. The first anonymous clinic, anonymous testing clinic. And after several years, it was made a permanent feature, and a lot of support from the Ministry of Health to do new things, to start new things. So, and we continue to have a lot of support. We worked with performers all the time, and as you can imagine, if you can imagine, in those days, there was no internet. So a lot of the programs were were done, on pages, pages and phone calls. This is done again, more campaigns working with talent agencies. I became very much involved in the National AIDS Society, which is probably akin to the ILDS. The IS runs the biggest global AIDS meetings, and they have one every year. And I attended many from the get-go, and there's photograph of Alvin and Wilfred and myself in Amsterdam. And there's lots of stories, that go back all the way. We was moved from Boston to Amsterdam in 92 because in America, the USA introduced travel restrictions and was refused to go to a place where there were travel restrictions on people living with HIV entering for the meeting. So I'm just going to skip over the various years, and it was really, really the first decade, the first 20 years was very, very action packed. Just to say that this is all in addition to the work I was doing in National Skin Center. This is really my double job, so to speak. I was really fortunate in that my boss, Professor Goh, I think many of you know Professor Goh Chi Leok, he was really understanding, and he completely supported all my additional NGO activities, which was really, I have to acknowledge his support. I was involved in a lot of advocacy, and this is part of the advocacy here, which was our own version of Stonewall in Singapore in 1993. So we went on and continued, and I think one of the things I want to say was that, unfortunately, in 1997, we actually were going to host Princess Diana in Singapore for our fundraiser, and obviously she died, and she passed away. She died two weeks before her Singapore date, and we were all really shocked and very sad about that. And we missed the opportunity of hosting her in Singapore. That year itself, we started our first funds for medications. And if, as you know, HAART, or highly active antiretroviral therapy, was started in 1997. Okay, it was first introduced globally, and we started our first scheme. And in those days, it was not supported. It wasn't supported officially. So patients couldn't have access unless they could pay for proprietary medication, which, as you can remember, was very expensive. So we started raising money for funds. Our in the meantime, our programs for prevention continued. We had our first in 1999, our first gentleman who became a poster boy, a first public face of AIDS. Since till this point in time, AIDS was really a hidden disease. And Paddy, who's a dear friend of mine, was a very brave character. He actually staged a one-man show on stage as well. He died soon after his show ended. We started having first Singapore AIDS conferences, and we have been held it every 2 years since then without fail. So the advocacy was very important for us. And there were 3 wins in 2000. Hospices began to accept HIV positive clients. The Environment Ministry ended its requirement of burying deceased PWs within 24 hours in sealed coffins, and allowed more humane handling of remains, and foreign HIV positive spouses were allowed to no longer deported from Singapore. I fast forward to 2007, where all along we had a lot of outreach programs, heterosexual as well as MSM. And in Singapore, the key populations, like many parts of the world, would be MSM as well as high-risk heterosexual men. And we actually, for example, had programs targeting particularly these 2 main groups. I went on study mission with my Director of Medical Service, Prof Satku, and Mr. Koh was a senior person from that ministry, and other individuals from the Ministry of Health. Went to the United States. In the early days, I was optimistic that we could lick the problem, but after a while, I got more and more disheartened, because the things move so slowly, in particular the legal aspects of it, and the stigma was still so strong. In 2010, I was really pleased that the WHO awarded the organization a memorial prize, and this was presented to me in the World Health Assembly in Geneva, and this is me with my PermSec of Health in Geneva to accept this lovely prize. We started mobile testing services. The lady in the middle with the tudong was our last president of Singapore. At that point in time, she was a politician. And mobile testing service was really been very, very helpful in quite groundbreaking. You can see some famous characters there. When Harry was in Singapore, we also demonstrated it to him. And our second HIV positive patient even came out and really it's important to have PL-HIV as faces of the epidemic. Otherwise, people think it's a virtual disease and it's not. There's no humanity to it. We continue to have a lot of programs targeting. So though it's always raising money, coming up with ideas, operationalizing, and monitoring and evaluating all these programs all the time. The MSM program was increasing in its size and its outreach. Just a few thoughts of this was when I was interviewed in 2014. More or less everything we were trying to do was groundbreaking, at least partly controversial. This was precisely what AIDS taught the whole world and taught us. You cannot love the sinner but hate the sin. People have to be wholly accepted and treated. There will always be new battles and challenges. In 2015, another win for us was that we eased the travel ban for foreigners with HIV in Singapore. And it's a long story, but it was a really good, it was a great win for us in Singapore. So this was in San Juan, and I was at the ADA meeting in October 2015, and this is where I met Alfred Friedman Keene. I think some of you would know he was the first person who described KS and PCP among gay men in New York City, MMWR in 1981. So I was really excited to meet him. We have continued holding a lot of meetings. This is our first ever pre-exposure prophylaxis get together. And then we've managed to push PrEP usage and knowledge up. Calvin, 22, the youngest of 4 Singaporeans openly living with HIV, and also he still continues to work for the organization. We came up in 2019 with our first community health blueprint to to end HIV by 2030. All along, I've also been a great advocate for decriminalization in Singapore until fairly recently had a British law that criminalizes gay sex. Over the years, we've been calling for repealing of 377A in order to improve HIV prevention and access to treatment, access to care, and access to knowledge. And lo and behold, in 2022, Parliament repealed Section 377A, which was a really a wonderful bit of this. It was not our job. We had there were several other big community groups which are fighting for it, but the fact that I didn't expect this to be repealed in my lifetime, but it has been repealed. It's still in place in many British colonies, unfortunately. And another big win for us was that in 2020 was that drugs used for HIV treatment were now subsidized by MOH after many years of advocacy. And this is all the various efforts which we had through the years from 1992 to 2020 before ARV was listed on the standard drug list. And this is probably the last win which we've had fairly recently was a review of the Infectious Diseases Act to decriminalize HIV infection, and I think that we had a significant role in advocating for this change in the law. Not fair to lay responsibility for disease prevention solely on persons with HIV. And this is me writing letters. And through my career, I've written countless letters to the forum pages on all aspects of STI, HIV prevention, condoms, blah, blah, blah. So I'm not new to forum letter writing. And 2023 HIV disclosure law being reviewed, and then finally in 2024 they actually reviewed the law, and it's really satisfying and wonderful to have one's efforts rewarded. It takes a while. I think the laws take a long time to change, but I think you have to keep at it. Okay, a few things. How I mean, almost the 40 years of working in an NGO, we had lots of support, and this is from the newspapers. They were really supportive. They always reminded us about the main characters who led our lives in the past. My colleagues in the organization, it is a charity, and we have a significant amount of support from public as well as private individuals, and also the government is very supportive of us. My colleagues in the Department of STI Control were great. I think I miss them so much. Some of them have gone to private practice. And these are Chris Farley is a significant person in the STI world. I and him are co-chief editors of the Journal of Sexual Health for almost 20 years. That's him with some of our Singaporean doctors. From the early people who were my role models, I think some of you might or might not know, Jonathan Mann, who was the first director of the WHO's Global Program on AIDS, the GPA, and his perspective really shone a light on how we should be treating AIDS from day one. The AIDS epidemic is a global problem, and there should be a global solution found for it. AIDS is not just a disease, it is a human rights issue. It's a moral challenge to all of us. Lars Carlings was the founding president of the International AIDS Society, and Roger Dietels, who was my professor in the UCLA School of Public Health. Peter Piot was also a friend of mine and someone I looked up to, as he was executive director of UNAIDS for a long time. And Michael Kirby, WHO commissioner on AIDS, and he was a lawyer and really fought for the rights of the person living. Paradoxically, the most effective ways to combat the spread of HIV involve reaching out to and protecting those who are most at risk of infection. It's strange, all white men, but they were very inspiring for me. I was really an honor to have been a member of the Government Council for representing Asia Pacific in the IES for 16 years. And these were some of the last governing council before I stepped down from the board. Francois Barré-Sinoussi, who was the Nobel laureate who discovered the HIV virus, Sharon Lewin, and ladies, famous clinicians and epidemiologists from Australia and the USA and South Africa. Also, these are my regional friends, my regional partners in crime. I would say Dennis Allman from Australia was a sociologist, social scientist. Marina Mahathir, daughter of the Prime Minister, who was a dear friend of mine as well, and a staunch AIDS activist and women's rights activist. And I'm just going to put this up here. Our MSM and HS and heterosexual programs and other related milestones, and plotted against HIV infections amongst male Singaporean residents sexually transmitted. The blue line is heterosexual men, and the brown line is the orange line is MSM. The rates have come down, I think, to a large extent from many of the programs which we put in place over the last 30 years. And this is the same thing, but not just programs, but we also looked at testing, we looked at providing treatment and medication, and then also advocating for change in the legal and the legislation. But the epidemic continues, and we have not taken the eye off the ball. That's why I think we're managing to do this. So the new ABC really raise awareness of PrEP. Undetectable equals uninfectious, and the need for testing regularly, not letting our behavior get in the way of this amazing opportunity to change the course of the epidemic. Community, they know what to do, and then D is just do it. It's the new ABCD. And I just plotted what I was chair of a review committee in 2012. And at the end of this, I was looking at what did I achieve? How would have we achieved? Yeah. The tick means we managed to do all that. Great. So, I think that my career has been quite satisfying from that point of view. Now I'm going to quickly switch gear to dermatology. And I was director of the NSC between 2004 and 2014, 10 years. I succeeded Professor Goh Chi Leok and was succeeded by Professor Tan Swat Hoon, both of whom are continue to be my colleagues in the National Skin Center. And this is me in the Middle Road Hospital, where the end of the lightning is. This is probably after I'd come back from from the UK. It's a very old hospital, very small, full, very crowded. We saw so many STD cases. It closed down in 1988, and then we moved to the National Skin Center. Many of you would have visited us. And when I took over in 2005, one of the first things we did was roll out the complete electronic medical records to take over. All paper records were destroyed. And this is me as the Minister of Health at that point in time, Dr. Khaw Boon Wan, doing the ceremonial bonfire of all our paper records. Yes. We helped introduce a lot of new clinics. So we had a wound clinic, we started inpatient dermatology as a specialty, vitiligo clinic, which eventually became a pigmentation clinic, angioedema, hair and nails, skin health or psychodermatology. We introduced most micrographic surgery, started a skin cancer clinic, adult eczema clinic, immunodermatology clinic. This is me, Professor Sarkar, and Professor Chua. Professor Chua on the left is now the director of the National Skin Center. He has succeeded Professor Tan Swat Hun. Gentleman was a then director of medical service. Dr. Sarkar is really supportive, and I miss his directorship of the medical services. But he opened the Mandalay Clinic, which was a laser and a laser suites in the National Skin Center. And then I continued to open new things, the acne clinic, an itch clinic, a pigment diseases clinic. So we introduced a lot of new subspecialties, got people trained in them, invited specialists to come and talk to us and send people overseas to learn these areas. I was also very fortunate that I was involved in the Skin Research Institute of Singapore, which is a tripartite arrangement between the scientists of the Agency of Science, Technology and Research, or ASTAR, ourselves, it's a clinical arm, and then the Nanyang Technological University, which was the engineering arm. And this was a concept which was launched in 2013. And that's me with some of the people involved. This is Birgit Lane. This is several people from the three institutions, and I'm glad to see that this institute has grown from strength to strength. One of the things which we had to do, was to make sure that our quality was up there. And I think many of you who work in institutions would know about JCI accreditation. And in 2007, we attained the first ambulatory center in Southeast Asia to obtain JCI accreditation. And since then, we've been accredited all along. I think that, at some point in time, I think it was towards 2010, I thought that, we needed a bigger building. Because we had long-term plans, and we are outgrowing our existing size. So I got together a team and finally got the approval to build a new building. And it's not easy to do it in Singapore. As you can imagine, there's lots of hoops to jump through. But I think that to ensure that the money is spent properly and so on and so forth. So time lapse. I thought this was quite cute to see. So that's the old building in there. Now you can see the new building being. It took about 2 years or 3 years to build, a long time. And partly this is during COVID as well. So I think some of you have visited us. It's double the size, double the floor space of the old National Skin Center. And I'm very grateful that my successors really saw this to its completion, and we really love our new home, the National Skin, the expanded National Skin Center, which opened in 2023. Okay. So I thought I'd say a few words because I think Rashmi wanted me to talk about the WCD and how we managed to win the bid. So it started with a bicycle ride in San Francisco AD in 2015, and we were riding across the Golden Gate Bridge, and we were having lunch. I said, let's try and bid for it, okay? And a few of them were very interested, and then we at a regional conference the following year we announced our bid for it, and then a lot of work was done, and after that point in time, this is the timeline from 2015 onwards, and what the things we had to do, getting support from our own local organizations, organizing Singapore meetings and various international meetings, 2018, 2019. You can see here, we all attended these things and had events and presentations and so on. Dermacon Bangalore, for example, bid videos. Got engaged our PCO for this, and then in Milan is where we won the bid to host the 25th WCD in 2023. This was followed rapidly by COVID. Okay, so COVID hit us in 2020, 2021, it was a global thing, but planning continued, and all our meetings were held online. Okay, so even the local organizing meetings were all held online, let alone the international the board meetings, the scientific chair meetings were all held online, and so it was difficult. It was very challenging, because it's much easier face to face when you have a huge program. And I think Jorge will attest to this, that it's was much better this time around. Nevertheless, it was something which looking back, I was really fond memories for the wonderful things we managed to do in terms of putting a wonderful scientific program together to make sure everything turns out beautifully, and it ran like clockwork, working with my great PCO, which is Triumph, and so on. So this is in 2021, and then 2022 was a really packed year, because that was when we started having actually face-to-face meetings here, face-to-face, and then we went all over the place, all over at meetings in Lima, in Australia, in Tokyo, regional meetings, and then this culminated rather in D-Day, which was 8th of July 2023, which was the WCD, and this is some pictures of me and Lars with the gavel. This is some numbers there. Scientific program, abstract-driven sessions, other sessions, the exhibition, which was really, really beautiful. We had a lot of publicity, a lot of support by our main newspapers in Singapore. They were really supportive. They were shocked. They said, "How many people?" And I told them, "Oh, at that point we thought 11,000." What? So they said, "No, they must come and cover it. They must come and cover it." And this was our lovely event in the past day. So it would not have been possible, the 3 tracks of my career without all these people. And like to really also say that it's in Ministry of Health, from the National Skin Center, the STI Control Department, the Action for AIDS, the affected persons and communities, other community groups, colleagues in the CDC and the National Center for Infectious Diseases, School of Public Health, Health Promotion Board, and then particularly my family and loved ones, who really I was quite overbearing at times, I'm sure, because I was quite hard pressed for time, and usually lessons learned. I think one has to build partnerships and teams, nurture allies, and cultivate support. I think we could never have done this alone, obviously not. And people have to believe in oneself, in you. Persistence, perseverance, and patience. I have a lot of persistence. I think that swimming has taught me that. Otherwise, I would have stuck to my community community organization. Haven't stuck to working on a WC, for example. Think big and think out of the box is what I tell people all the time when I'm talking about programs and how we're going to do this. Always think about social determinants of health and disease. focus on key populations. This is particularly pertinent to HIV/AIDS and STIs. Something which I think people must realize that communities are central in disease management responses. Nothing about us without us. We must learn the lessons from HIV/AIDS. Don't reinvent the wheel. These are some of the awards I got in the last few years, and I only dwell on this. And I was wondering whether my father would be quite proud of me. I didn't join him, but I think maybe he would probably not have objected if he'd known 40 years down the road that I had done a few things in my life. Okay, so that's all I have for you guys. Thank you.
Thank you so much, Troy. I think can stop screen sharing maybe.
Okay.
Yeah. I think it was all very fascinating, and I'm sure that all the listeners would have learned so much from Roy's journey. You did quite a few things, Roy. At least I said three things, but I realized it was actually four things, when I heard that. And I encourage people, you can ask questions. There is already one in the box. But before that, Roy, I think I'm going to take this, not going to miss this opportunity in asking you one or two questions, which came to my mind. So one thing that I found very fascinating about your journey was the beginning, of your life when you were an Olympic level swimmer. I think it was in 1972. And, that was something I was wondering that, you were such a good level swimmer, why did you not think of continuing in that? And on the other hand, do you really think, that this level of discipline, which is there in sports, does it really contribute, to leadership and all later on in life? They're very diverse things, but do you really think, it contributes?
I think so. I think I'm swimming in those days. I mean, I represented Singapore since I was like 11 years old or 12 years old. Can you imagine?
Right.
And
Yeah.
I swam competitively till I was in the third year of medical school. At which time I said, no, enough is enough. No, you can't carry on, especially if one is doing medicine. And you get tired of it after a while. So no, you can't carry on, and you have to get on with other aspects of life and your career. And my father being a doctor was a huge influence on what I was going to do in my career. Yeah.
Absolutely.
Yeah, then definitely the discipline and the doggedness one has, what I was brought up with had a huge impact on what I was doing later on in my studies as well as in my
Yeah.
career. Yeah, for sure.
So, I mean, congratulations, it's just been this very wonderful journey. But as I said, there were three very important facets that you talked about. They're quite different from each other. From a
Yeah.
clinician interested in HIV, way back in the 80s, when, it had so much stigma attached to it, not like what it is today. Today, it is, pretty much a disease which people know about, accept it, to the national dermatology leader. You ran organizations, you were there in leadership positions in Singapore. And then finally, the president of the World Congress of Dermatology in 2023. How do you think, what do you think actually were the turning points? Because, you went from one to another. It looked very
What was it?
smooth.
What?
How did
Yeah.
these shifts occur?
It was actually concurrent, Rashmi. When I was running, I mean, I'm still president of the committee of Action for AIDS now.
Yeah,
When I was setting it up, I was seeing patients through the day. I mean, full
yeah,
clinics. I was running organization from my consultation room. So it's just a matter of time management, and then getting people to help, to be similarly, to encourage them who are similarly inspired to do things. Yeah. It wasn't like I dropped one thing, go to the next thing. It was
no, you
all,
didn't drop. Yeah, you do just
no,
doing
I
that.
never dropped anything, and I didn't drop anything. In fact, I should be starting to drop some things now because I'm past retirement age.
And in
Yeah,
fact, Roy, yeah, that was the other thing that a lot of people are curious, about this, because you are the only person who won the World Congress of Dermatology in one go. What do you think really worked? Because this is a question, which is there in everybody's
I think
mind.
I think we were really in the right place at the right time, and we had good strategy. I don't want anyone to talk too much about it, but we had a plan. We had a plan on how we were going to approach people to vote for us and to win over votes for us. The thing about Singapore is small, it's tiny. We only have about 200 over. At that point in time, there was not even 200 dermatologists, and people are always saying, how can you possibly do it? But we are greatly traveled, and we know a lot of people over the years when people
Right.
visit us, and many of us travel a lot as well. So the Singaporean dermatologists, many of whom are very well traveled and well known.
Very well known,
So
yes.
yeah, and then the National Skin Center had made a name for itself as well, as being a center of excellence and so on. So from that launching pad, um we started working out who can we depend on, who can I consulted a few people on how to approach it, and I don't necessarily want to mention names, but they were very good
Yeah.
in giving advice on who I should speak to in other countries, because we definitely didn't know many people in, for example, South Africa or Africa, South America or Africa. Those were areas which are not familiar to us. We were very familiar with Asian nations and Western Europe, and certainly in the United States and Canada and in India as well, and China, but not so well. So we had to go out and make ourselves known to all these other cities. So basically, it's trying to make ourselds known, and then to have a good proposal when we
Yes.
present it. I think it's very important to be able to present your why you should vote for us, why do you want to come to Singapore. I mean, Singapore also is one of these places which it's a very people want to
True.
visit.
Very
It's almost a no, but I think our challenge was, how do we make it affordable, and how do you get the right sponsorship, and then from the sponsorship point of view, we're really helped by our PCO. Um, so it's really putting together the proposal. It's very important, and also to
Yeah.
to be able to present it well at meetings and so on.
So I think
Yeah,
you rightly put it across very modestly, I should say, Roy, that, after winning the bid, that, it's the right place at the right time, but it's also a strategy, a good, positive strategy. Having the right kind of inner circle around you, maybe, and, approaching, the people who can give you the right advice. Positive people, who are able
yeah.
to give you positive advice. It's very important. So
Jorge is a question.
yeah, I think Jorge can ask if he wants to, and the other one is Rajata. So if Rajata, if you want to ask, you can be unmuted and you can ask that question, if you want to. Jorge, you can unmute and ask.
Yes. Hello, Roy. How are you?
Hey, Jorge.
No, I
Uh,
really
¿Cómo
want
está?
to. Very well. Very happy to be with you. No, and I would like really to congratulate you on your
Thank
standing
you.
and truly inspiring presentation. Your work, particularly in the field of sexual transmitted diseases, is remarkable. As you mentioned, not long ago, a condition such AIDS represented an enormous global challenge, and your involvement during those critical times is deeply admirable. You stand a true inspiration not only for us, but for future generations, demonstrating the importance of commitment, compassion, and active engagement in addressing the social and medical challenge we face today, as well as those we will undoubtedly encounter in the future. And we have also close following your guidance in the preparation for the next World Congress. As you all know, we are having here in Mexico. And because your Congress was a great success, largely owing to your leadership, your vision, and friendship. So I just want to congratulate you, Roy, and you're really an inspired guy.
Thank you so much for your kind words, Jorge. We look forward to seeing you soon, definitely in Mexico next year, if not earlier. Is there
So
any?
I think, yeah, there's one more question. Rajita's there from India, Hyderabad, India. She wanted to ask you a question. Over to you, Rajita.
Yeah. Hi, Dr. Chan. It's been very inspiring listening to you, your journey. Now, I have a question. Didn't you have any resistance from your own colleagues in the Singapore Society of Dermatology when you wanted to change the world, your world, change the laws? How did you manage that?
No, we were up against a lot of the more conservative sections of society for, I think that we have to, but our arguments are based on scientific fact and evidence. So we always base it on that. And also the fact that, human rights is important. Although it's not such a big deal in Singapore, people don't like the word, but I think that we have to always go back to the fact that, if we don't look after the weakest in the community, we will fail in looking after the whole community. I think that was a very important point, which Michael Kirby, as well as especially him, he was talking about it a lot. Yeah, so there was a lot of I used to write, as I was sending you forum letters all the time, and every time World AIDS Day came around, religious groups would say, no, you cannot talk about condoms, you can't do this, you can't do that, and I'll have to write in to say why we have to address these things and have to be very dispassionate about it. Yeah, I mean, there was objections, but now the thing has completely changed. The times have changed. I think there's no more issue with that, hopefully. And the fact that we can actually change the laws, 377A, for example, change the Infectious Diseases Act, for example, amend it so that it reflects current understanding, scientific fact, rather than laws which are rolled out in 1980s when people were so completely frightened about HIV/AIDS. Yeah.
Thank you so much. In India, we are fighting quackery. We have so many people of varied specialities and unqualified people trying to enter our dermatology arena, and we are trying our best to safeguard our public. So we hope to take a lesson from your life. Thank you so much.
Thank you so much, Razeta.
Thank you.
Thanks, Dr.
Rohit, there's one more question. I'm going to take up from the question box. That's from Amr Gohar. She's from Egypt. Do you want to ask the question yourself, Amr, or should I just ask on your behalf? I think you can ask.
Good afternoon. I'm asking about the availability of the HIV PrEP and HIV PEP in Singapore. Are they easily accessible?
Yes, they are easily accessible. They're not free. They are accessible, but patients have to pay something. We don't have a free supported program.
So it's not like the United Kingdom. It's unlike the UK.
No, it's different. Yeah, it's different. Like nothing. There's not just HIV/AIDS in any infection, any disease here. There is a certain amount of co-payment.
In Egypt, we have free access to HIV PEP and PrEP, but with certain strict criteria, which is more strict than the UK one. The risk assessment is a bit different. And actually, I had collaborated with the USA Aid for AIDS International since 2001, providing free medications to Egyptians and non-Egyptians based in Egypt.
That's great. I mean, it's just the norm here is that there's nothing for free, unless a patient is really unable to pay for it. There's always the means testing and so on and so forth.
Yeah.
Yeah.
So there's one more question, but I think you've answered it. Part of it was Rajata's question. This is from
right. I saw that.
Nicholas Smith. Same thing. What gave you the courage to stand up and advocate in times and in a culture that must have been unsupportive or even hostile? I think you answered that question, right?
Yes,
And
I mean, yeah, no, I was quite young. I was quite, I was quite, I wasn't frightened. I think when you're young, you can do things, and then you should be doing things when one is
you
young.
should
This
be
is the
doing
sad,
things.
yeah.
Yes.
You should
Yeah.
be doing things. We should be, you know, I had my own moral compass, so to speak, and you can say that, that things which were not right and needed to be corrected.
Yeah, I think that's a very important message, maybe also to the youngsters now. One more question I wanted to ask you, Roy, you've also helped to build up the National Skin Center. Actually, I've been there and it's a wonderful institute. I was fortunate enough to go around. And what mattered to you more, the systems that were already inbuilt or the people? And the other thing is, how do you sustain that excellence, in the institute once you step down? Actually, this is a very important question. Once you have something going.
Well, hopefully, once successors are also, good enough to sustain. I think definitely, it's a challenge always. I think dermatology everywhere. The challenge is how do we keep
Keep it
physicians
going, yes. Some of
in
the,
this, yeah,
yeah,
before going to private practice. I think that's a challenge everywhere in the world. Our specialty is such. So it's always looking at work-life balance, remuneration, making sure that there are people are recognized, they're given the opportunity to have a career, a great career, uh, you know, um, to pursue things they want to do, to make sure that they're not missing out, um, and given the responsibility at a relatively early age to take over, to do things. It's my thing. I think I mentioned earlier on regarding, I was given a lot of leeway by my director, Prof Go, and there was no issue regarding anything I wanted to do. So some of the stuff which I was fighting for, um, at some point, people would ask me, "How can you do this? It's so you're sort of in the government practice current service." But I guess I was quite a forceful character as well. Um, and I was never afraid of speaking my mind. So
yeah.
people were less likely to object to my harebrained scheme, so to speak. And I got things achieved. But I was also very patient. I realized that you can't do things overnight. It takes a while to make people see what you're doing, see how you're doing it, and to be persuaded that you are actually on the right track, and you're being constructive rather than just being destructive. So I think it takes a while. It takes a lot of EQ, managing your friends and superiors, and getting them around to see your point of view and supporting you. So that's a part of the work, is that it's very important.
So I think you mentioned something which is rather important, Roy, something I believe in. One is constructive leadership. The other thing was EQ, which you mentioned. I think we all have the IQ, we all want to be there. But the EQ does make a lot of difference.
Yeah,
It
of course.
probably, yeah. I
Yeah.
think how successful you are in the right sense, maybe 5 years down the line, I often tell the residents, is your EQ, if we work on that, that's important. People management is really important. So that was put down rather well. Yenlu has a question. Yenlu, do you want to unmute and ask Roy, or should I ask, In fact, she's asking what I would have liked to ask you. I would also actually like, Yenlu, do you want to unmute? She's asked that, hi Roy, what
I saw
advice?
that. I'm seeing it. What advice would you give leaders who have the means and power to support and nurture future leaders like you? I think they should do it. They should just do it. I think I in my time there weren't so many leadership courses and so on and so forth. We just went out and did it, right? Nowadays there's a lot more training which people can go through to nurture and to train their leadership skills. But definitely give people a chance. Definitely give people a chance and not hang on to it. Yeah, so that's and in a sense it's quite good because in the Singapore institutions there is a succession planning, certainly in the government institution. So one doesn't stay on as director for unnecessarily too long. So you have to rotate and give other people a chance, and even the discipline, the subspecialty heads are rotated out, and so on and so forth.
So what do you think of that? Do you think that's really good? Because this is something, which is very controversial, even in India, whether one should rotate off or not,
I think I think that at the very top, one should rotate off. But if it all depends also on how thick the talent pool is below. Okay. If it's no point rotating off if there's no one wonderful to take over. I think that's important as well. Yeah. So
the other question is on the other side, probably one of the last questions, because I think it was so interesting that people had a lot of questions. This is a question from me that what advice would you give, Roy, to the current generation of dermatology leaders, actually? What should they do differently, and is there personal sacrifice involved? I think there is always personal sacrifice involved.
I think for sure. I mean, I don't think one can be a dermatology leader if one doesn't sacrifice some aspect of one's it's very hard to have everything on, to do everything and to have everything. But once you make a decision, you should stick to it, I think, as far as you can, as long as you can, until you achieve something. One of the things which I mean, if you give me 1 or 2 minutes, one of the things which, as director of NSC, I introduced was a seamless training program, which mirrored a lot of what Americans are doing. That means out of med school, they get streamed into dermatology residency directly, and at that point, I was convinced that was the way to do it, because most of the time dermatologists see dermatology, and then they didn't really need to do it so much internal medicine. So as you know, the British system is you do internal medicine or MRCP first, and then after 3 years, and then after that you do 3 or 4 years of dermatology training. So I introduced a seamless program where instead of doing a MRCP or its equivalent, we would put trainees through preferred postings, and our preferred postings was certainly plastic surgery, RAI, infectious diseases, pediatrics, and maybe one posting in internal medicine, rather than doing a lot of internal medicine posting, which we will never use. And at the same time, we also encourage people to do a research, to take up research. Unfortunately, the scheme ran for 10 years or more, I think 15 years maybe, and it has produced a couple of PhDs, a couple of MPHs. And these people were the ones who came through the seamless program. Then, unfortunately, the Director of Medical Services, who succeeded Professor Satku, I showed you in the photograph, put an end to it, and I was really unhappy. So we're back to square one in terms of training everyone in internal medicine. It's not important, it's important, but dermatology is so much more. It is so much more than just internal medicine. There's surgery, there's pediatrics,
yes,
and so on. And then you for internal medicine, you want to focus on those which overlap significantly with dermatology. I mentioned immunodermatology, I mentioned histopathology, for example, surgery, for example, infectious diseases, STIs, right? And then you got to get people to do their MPH and get to do their research. So we lost out.
So thank you so much, Roy. I think all those who have been listening to us, he's given you an insight how you can do a lot of things together. You know, you can do them well. And I think you've gathered from this that what makes it work is he's very passionate about it, you know, what I could see, you know, unless you're passionate, unless you really like, you know, you enjoy what you're doing and you want to give back, I think these things don't work. So probably he's done it and he's done it equally, you know, used an equal energy for doing all these things, you know. So that is something to learn from him. That is very inspiring. And I learned a lot about you also, Roy, through this, you know, talk. I thought I knew quite a bit, but I think I've learned some new aspects.
Yeah,
And
thank you.
there's always so much to learn from each other. I'd like to thank you, Roy, because you took us through that journey. And you also were patient to answer so many questions, but you said that
A
you're
pleasure.
anyway a very patient person. And
Yeah.
thanks to the audience, because I think they have been very interactive, you know, they joined and they have really asked us questions. And, you know, thank you so much on the occasion of World Health Day. We couldn't have had it better. Please look out for more of our global leadership journey webinars, you know, which the ILDS Education Committee is going to bring to us. Thank you so much. And if you have any other questions, I think, you know, you can always send it to um, the ILDS, you know, Secretariat, and they would answer back to you. Thank you so much. Good
Thanks very
evening.
much, everybody. Thanks for staying on for so long. And thank you for the Secretariat for organizing this.
Yeah, thank you to the Secretariat, you know. Thank you.
Thanks, Rashmi. Good night.
Thank you. Good night.